Hello, I'm Shellie, the Serenity Doula, and welcome to the video all about breathing and how it can help you during labour. So what we need to do when we're in labour is make sure that we are increasing our oxytocin production, which is the hormone of love, and it is the hormone that makes us feel relaxed and happy, and it is also the hormone that initiates and increases the strength of contractions. So without oxytocin, labour stops. Now there's an antagonist hormone to oxytocin that we will have all heard of, and that is adrenaline. So when our adrenaline peaks, the oxytocin goes down. So it slows the contractions, brings them to a stop. And also it makes us be more aware of what's going on in our body, because with oxytocin production we get an increase in endorphins, which are our natural painkillers. So as that oxytocin goes down, the endorphins go down and we start to feel the sensations more intensely. Now there are certain points in labour, we call them bumps in the road, where we get an increase in adrenaline. Now the reason why this is happening is that your labour is shifting up a gear at those points. So there are several points throughout labour, almost points where your body is saying, okay, right, this is really starting to happen now. I need to be in a safe place. Are we in a safe space? Is it okay for us to go ahead? Or do we need to stop? So we normally get that when we're transitioning initially from a latent phase of labour, coming in at around about 3 centimetres we can get one. And when you get that increase in adrenaline, what happens is you can often feel shaky, you often feel cold. Sometimes you feel a bit sick or are sick. And you often feel a little bit more worried, a little bit more panicked, and that's that adrenaline increasing in your body. So if you know that it's going to happen, you can welcome those feelings and just come back to calming yourself down, building that oxytocin back up again. In which case those transition periods are then very, very brief, very short. You recognise what it is, you think, okay, I'm in a safe place, I'm just going to concentrate back on my breathing, I'm going to keep really calm. And that feeling of panic, that shaky feeling, that nausea feeling, that will calm down very quickly, and you'll get back into that lovely frame of mind where you're just focusing on yourself and your oxytocin is increasing, just focusing on your breathing, your contractions are getting stronger, and your baby's going to come to you faster. So after the around 3 centimetre one, we sometimes get a little bit of a hump at around 5 centimetres, and that's when those midwives are thinking that you're in active labour. So this is when the contractions are becoming longer and stronger. It's when you might think about going towards the hospital. So you're getting 3 contractions within 10 minutes and they're lasting for approximately a minute. You can't really speak through them. You're having to just focus on breathing because they're becoming more intense. And remember, with each contraction, you're one step closer to the baby. Okay? So they're a good thing for them to be happening. We then get another, which is the big transition, when the cervix is fully dilated to around 10 centimetres. And those contractions that have been opening up the cervix, I don't know if you've seen my video about the cervix opening with a balloon. So the cervix has come open and the muscles have been drawn up into the uterus, and then we start to get the pushing down of the baby out through the birth canal. So just as we switch from those dilating contractions to those pushing down ones, that's when we have the biggest transition of all, because that really is the point of no return, where the baby's going to start being pushed out. So this is the one commonly where people think, oh, I can't do this, I want some pain relief, I want to go home. There's this kind of strong urge to be somewhere safe, because that means the baby's really coming. So your midwife or your doula will be very excited at this point, and now you know the secret, you will be too. So through all of these transitions and throughout all of your surges or your contractions, what we want to do is try to make sure that there is plenty of oxygen getting to your uterus and to your baby. And we want to keep that adrenaline down, because what adrenaline is part of the fight or flight system. So when we have a peak of adrenaline, it actually draws blood away from the uterus, away from where those muscles are contracting hard and they need a lot of blood to oxygenate them and keep them working well, and also brings blood away from the baby. And so we want to avoid that, because we want everybody to stay happy. We want the uterus to be working as best as it possibly can and as comfortably as it possibly can, because if we take oxygen away from muscles that are working, they begin to feel more discomfort. So there's a thing you can try where you raise your hand up in the air like this and just contract your hand like this. And so your hand is working really hard, but it's in a position where it's not really getting very much blood because it's well above the heart. And if you do that for a minute, you can just try it yourself. See what happens after a while. See how uncomfortable it starts to feel in your hand because it's not really getting that oxygen to it. The waste products aren't being taken away as easily. The muscles are starting to feel tired, maybe a little bit tingly. And then if you look at your two hands, they can look a bit of a different colour. Don't know if you can see that there. So this is the same principle with your uterus. We want to make sure that the blood is coming to your uterus and it's all working as well as it possibly can. Number one, so your baby gets to you faster, then the labour progresses better. Number two, so it's more comfortable for you and the muscles are working very well. Number three, so your baby is getting plenty of oxygen and feeling really safe and happy and calm the whole time. So in order to do these things, we want to be in a good position where we're getting good blood supply to the uterus. So we can do this by being in upright positions. This means the muscles have to work less hard as well because gravity is helping to move the baby down. So you can see my video on different positions for labour and also the video where I show the baby's movement through the pelvis, and that has some different positions on there, ideas for you to try. So with deep breathing and relaxation, we can help to increase our sense of calm. We are going to ensure that our abdomen and lungs are expanding really nicely and allowing a lot of space for the uterus to work effectively. We're going to keep that blood pressure at a healthy level. Your baby and your uterus are going to have all the oxygen that they need. Your oxytocin levels are going to go up. Your prostaglandin levels as a result will go up. Your relaxin levels as a result will go up. All of these helping to open the cervix, soften the cervix, open the pelvic floor and make space for the baby to come. And also our endorphin levels are going to go up. So that helps us cope with the sensations of labour. Everything is going to become more easy and more manageable as you become more relaxed. And how do we do that with breathing? Well, I know you guys are all experts on breathing because you've been doing it since the day that you were born. So it's nice and easy to do. Get yourself comfy if you want to have a little practice now. So what we want to do, the main principle really, is to just breathe slowly and controlled in a calm way. So if you think about when you have a fright, what do you do with your breathing? You're breathing, you start to get a bit fast, everything tenses up and you feel panicky. We want everything relaxed. If you are tense, it means that your uterus is trying to fight. Remember that tug of war we were talking about? We don't want any resistance on the other end of that tug. We want that uterus to be able to open, so we need everything to relax. So try to remember to soften your shoulders, relax them down. I want you to take a nice deep breath in, breathe in through your nose, and out through your mouth. Remember how I said to you in the other video that if we have a relaxed jaw, it relates to the pelvis and helps the pelvis to relax. So as you're breathing out like that, just relax through your mouth and jaw. Now with breathing, if you actually lengthen the out breath, so it's longer than the in breath, it helps to really calm and slow your breathing rate, slow your heart rate, and relax the body more. So you can practice breathing in for 4 and then making the out breath longer. Okay, so you might be able to make it 6 seconds, you might be able to make it 8 seconds. You may even be able to make it longer. Let's have a little practice now. So breathing in through the nose and out. 2, 3, 4, 5, 6, 7, 8. In. 2, 3, 4. Out. 2, 3, 4, 5, 6, 7, 8. In. 2, 3, 4. Out. 2, 3, 4, 5, 6, 7, 8. Notice how your body feels now. Do you see that everything feels calmer and more relaxed? So you can do that during your surges, that type of breathing, as that cervix is dilating, and that will really help to calm and relax things. And you will notice the difference if you forget to do your breathing, that it really changes the nature of how things feel. And any time in your labour, if you've forgotten everything else you've learnt, just come back to that breathing. And if you have a birth companion with you, they can help you to just bring you back to that in for 4, out for 6 or 8 or longer if you can. In for 4 through the nose, out for 6 or 8, nice and gently. And that's really great. If you're finding it difficult to relax and let go with things, or something's feeling really tense, you can do what I showed you in one of my other videos, which is horse lips. So that really helps to relax around the jaw, which again helps to really relax the pelvis. And it's quite funny when you do it, so it can help to giggle and release oxytocin, break any tension. So for this one, we take a nice deep breath in, and as we breathe out, we relax the jaw and the lips and just let everything. That's a really good way to just let go of some tension. Now, when we move on to the second stage of labour, where those contractions are changing in nature and the body is pushing the baby down. Okay, so remember that we don't really have to actively push in labour. If we've not had an epidural and you're having a natural birth, your body will do everything it needs to do itself. It's designed to have babies. So you can trust your body and just relax and just let things happen. Sorry, excuse my little helper coming in the background there. So as we're relaxing and we're just letting things happen, remember that if you were in a coma, your baby would come out. So you don't have to do anything apart from breathe. The most important thing for you to do in labour is to relax and not let your thinking brain get away with itself getting worried. Just allow it to be calm and restful and peaceful. So as the body is pushing down, you may find that it's more difficult to take those long breaths in and out. And you may start to make involuntary noises. So you may be breathing in, and then as that surge is happening, as you're breathing out, you might start going and not be able to stop that noise coming out. So I remember this from when I was in labour, feeling like I was really connected to all of the other animals that gave birth. I'd never heard myself make that noise. And I was like, I could really sound like a cow. And I thought, oh yeah, well, I am a bit like a cow, really. We all give birth in the same kind of way. So don't worry about any sounds like that. They're completely normal. And if you're taking a nice deep breath in and you're making a sound like that, you know that you are relaxing and allowing your body effectively to use that surge to the best of its ability. What you can do with the breathing is if you take actually a relatively short in-breath, and then as you breathe out, imagine that breath going down into your body to help the baby come out. So in some technique, some types of hypnobirthing, they call this the J breath. Some people call it the down breath. But you are taking a breath in, and then as you are breathing down, imagine you are breathing your baby down and out. So okay, I'm just going to turn sideways to show you what I mean about a J breath. So you breathe in, and as you breathe out, down and out like a J, the shape of a J. Now, the best way to practice this breath is as you are on the toilet. So it's a really good idea to practice these breaths before you get into labour, so they become second nature. So when you're going for a number 2, going for a poo on the loo, just practice this J breathing or this downward breathing. And you'll realise actually that when you do it, you're not straining down, you're not like, you're just breathing it down. It really helps to relax everything through the body. You're going to relax the pelvic floor so it makes more space for the baby to come out more easily. And the same thing if you're on the toilet. If you feel constipated, doing this kind of breath is much more effective than straining and pushing like that. If you're straining and pushing and tensing everything, you are much more likely to get bulging in the veins, which can cause hemorrhoids. So keeping your body relaxed in this way really helps that baby, just the space for the baby to come out and no pressure increasing in the pelvis. Just allows the natural pressure of the uterus with nothing else resisting it. So practice on the toilet, and then you'll be an absolute expert by the time it comes to the birth of your baby. In the last part of your baby being born, where the head is crowning, your midwife can help to guide you, just so that as that baby is just stretching the last part of the skin before they're emerging out, it might be better not to be aiding that breathing down, just to slow everything right down so that that stretching can happen just nice and gently and slowly for the baby to come out. It lessens the likelihood of tears. So the midwife may just say, stop pushing now, and just to gently okay, so you're not adding to that downward push, but just allowing the body's natural push to let the baby's head come out. Something just to let you know that commonly happens as the baby's head is emerging is that sometimes part of the head comes out and a little bit is stuck. So the midwife may say to you, just when you feel like the contraction is abating and you've pushed enough, they might say, just give me a little push, and that just allows the baby's chin just to pop out. So that then for that rest period in between that surge and the next one where the baby's body can come out, it just means that the baby's comfortable and their whole head is out. That's just another little tip for you. Now, if you'd like any more information about doulas or birth, then please do check out my website, www.theserenitydoula.co.uk, and remember to give us a like if you enjoyed this video and found it helpful, and click subscribe so that you don't miss any of our other birthing videos. Also, we'd love any comments, or if you have any ideas for anything you would like to know about birth or beyond, the way that resonates with you, then let us know and we will make a new video. Thanks very much for listening, and I'll see you on the next one. Take care. Bye.